Acute kidney injury is a condition that stops the kidney from functioning, which can lead to complete kidney failure. From July through October 2022, the Gambia experienced an abundance of AKI cases, hence the AKI Outbreak 2022, which resulted in the deaths of dozens of children under the age of 5.
The committee suspected that the AKI could be caused by drug toxicity since paracetamol toxicity was identified as a cause of AKI in some countries in the past. The World Health Organization country office helped to send patient samples and samples of drugs used by these patients to laboratories in Senegal, Ghana, France, and Switzerland. The Ministry of Health decided to ban these drugs even before receiving the confirmation from the laboratory testing.
The outbreak prompted the President, His Excellency Adama Barrow, to establish a task force to inquire into the deaths of the children as a result of the consumption of contaminated medicines imported into the country from India, believed to have caused the acute kidney injury.
The laboratory analysis confirmed that toxic levels of ethylene glycol, EG, and diethylene glycol, DEG, were found in 4 syrups, namely promethazine oral solution, BP, Cofexmalin baby cough syrup, Macof baby cough syrup, and Maghrib cold syrup. All 4 of these products were manufactured by Maiden Pharmaceuticals in India and were imported to the Gambia by Atlantic Pharmaceuticals. Government immediately banned Atlantic Pharmaceuticals, who got their license withdrawn and their premises closed. This was followed by police investigation into their activities. The Medicines Control Agency sprang into action with series of steps to remove the drugs from circulation.
The task force submitted its report to the government earlier this year, and it was subsequently unveiled to the public during a press briefing on Friday in Banjul, presided over by the Health Minister Dr. Ahmadulamin Samate. Speaking at the event, attended by cabinet ministers, senior government officials, and families of the victims, the health minister described the outbreak as a national tragedy.
We have never lost sight of the fact that sadly 70 children died as a result of the outbreak. The AKI outbreak was a national tragedy. This was a very difficult moment for all of us, and we wish to emphasize to the bereaved families His Excellency's President Barrow's resolve and that of his government to addressing this issue.
The report contains the findings of the task force, which, according to the health minister, mirrors the findings of various technical groups that investigated the matter.
First, the task force confirmed that the deaths can be conclusively linked to the 4 cough syrups imported by Atlantic Pharmaceuticals from Maiden Pharmaceuticals in India. The task force also investigated how these syrups were imported from India and distributed in the country. They learned that the affected medicines were not registered with the Medicines Control Agency, even though the regulation requires all medicines to be registered before importation. The task force indicated that Said Kebe, serving as a supervising pharmacist for Atlantic Pharmaceuticals Company Limited, admitted to signing off the importation of the 4 cough and cold syrups, later found to be contaminated.
Dr. Samate also revealed some of the key recommendations of the task force and government's response to the recommendations, which include the immediate termination of the services of the Executive Director and Deputy Executive Director of the Medicines Control Agency of the Gambia, and potential legal action against Atlantic Pharmacy in the Gambia and Maiden Pharmaceuticals in India.
The government of the Gambia should refer the matter of Said Kebe, the supervising pharmacist for Atlantic Pharmacy, to the Pharmacy Council for appropriate disciplinary action. The response is that the matter of Said Kebe will be immediately referred to the Pharmacy Council for appropriate disciplinary action. The government of the Gambia to permanently revoke the importation license issued to Atlantic Pharmacy Company Limited and their directors. The response is the license of Atlantic Pharmacy Company Limited has been permanently revoked. the government of the Gambia should with immediate effect dismiss the executive director and deputy executive director and consider prosecuting them in line with the relevant laws for their abdication of their official duties. The response to that recommendation, considering the foregoing, for the purpose of strengthening the MCA and restoration of public confidence in the institution, the executive director of MCA has been dismissed with immediate effect, and also the contracts of the deputy executive director is terminated with immediate effect. The report will also be forthwith transmitted to the Gambia Police for further action. Recommendation number 9, the government of the Gambia through the Ministry of Justice and Ministry of Foreign Affairs should forthwith explore the possibility of instituting further legal action against Atlantic Pharmaceuticals and Maiden Pharmaceuticals and should engage with the government of India to seek criminal and civil redress on behalf of families of the victims of the AKI outbreak. The response to that recommendation is the government is far advanced in exploring avenues for potential legal action against Atlantic Pharmaceuticals and Maiden Pharmaceuticals, as well as potential redress through engagement with the government of India.
The health minister assured the victims' families and the general public of government's commitment to the implementation of the recommendations contained in the report and the prevention of the recurrence of such tragedies. Alagie Mbye, GRTS News.